Welcome to Quality of Life Radio, hosted by Lisa and Nancy, editors of BigBlendMagazines.com.
Welcome to Big Blend Radio's Quality of Life show with Nancy and Lisa, publishers of Big Blend Radio and TV magazine, as well as Parks and Travel magazine. Today, we have Dr. Jackie Eubany back on the show. Dr. Jackie is a board-certified cardiologist and electrophysiologist and author of the best-selling book, Women and Heart Disease, The Real Story. You can get it on Amazon. You can go to her website, womenandheartdiseasebook.com. You can also listen to her past interviews with us here on Big Blend Radio and read her articles if you go to blendradioandtv.com. We're excited to have her on the show today because we're going to talk about AFib. What is AFib? I don't even know how to pronounce half of these things that she comes on the show and talks about, so it's going to be fun today. But we're going to talk about atrial fibrillation. Atrial fibrillation, I think that's how I can pronounce it. It's apparently an estimated 2.7 to 6.1 million people in the United States have AFib, and over 750,000 are hospitalized every year because of AFib. And this condition contributes to an estimated 130,000 deaths. And so we're very excited to have Dr. Jackie back on the show again to talk about this. I know September is AFib month, but this is something that runs year-round and all the time. So it's something that we should be talking about all the time. Welcome back, Dr. Jackie. How are you?
I'm good. Thanks for having me on.
Now,
Cool.
Did I say AFib and atrial fibrillation correctly? Yes?
Absolutely. Absolutely. That's how you say it. Atrial fibrillation or AFib.
Yeah, no, I've heard AFib more than the big words, and I always laugh that every time you come on a show, it's like it's an English class, for me. But it's true. It's I think sometimes we as human beings tend to not look at health issues and read about things because of the big words. Actually, I think we kind of go like, "That's a big word. I'm not going to look at it today," but it's important that we do. I think so, right? You've taught me a whole bunch. Yeah, so it's important that we break through the big word barrier and take care of our health.
I agree with that 100%.
Yeah. So with atrial fibrillation, I'm saying it again. I'm going to get points here, brownie points, is really like a heart arrhythmia. Now, a heart arrhythmia to me starts like, now we're going to get the rhythm and I'm going to start getting my drums out and having a good time, but it's really not a good time, right?
Yeah. So, I mean, yes, you can liken it to a rhythm actually, because, the heart beats in a normal rhythm that we're all familiar with. But atrial fibrillation is when the rhythm is offbeat and it's irregular. And that causes a lot of symptoms that can be uncomfortable for patients.
Oh, so it's like the person that picks up the tambourine in a live concert and goes off the annoying person. There's that one person that really can't play the tambourine and then has it, and I really can't stand that, but they do it, and it's off-putting, and it's sad because it's like now ruining the experience, but this is what's happening with your heart, that is off at that point.
Yes, exactly. It's irregular and offbeat because normally, in order for the heart to contract and pump blood to the rest of the organs, it needs electricity. And this electricity has to occur in a synchronized way, which we call a normal rhythm, in order for this electricity to generate the force that requires, that causes the heart to contract. But in atrial fibrillation, the rhythm is irregular. It's just coming all over the place. It's chaotic. And so it's not synchronized, and that's what leads to a lot of the symptoms that are associated with atrial fibrillation.
Wait a minute. Now, Nancy, you were talking about earlier. This is electricity going in our heart.
Well, yeah, but so I want to ask, what causes the flow of electricity or the rhythm to change? What interrupts that flow?
So there are multiple things that can predispose you to having atrial fibrillation. Some of the more common causes or risk factors is what we say for atrial fibrillation include things like thyroid disease. If your thyroid is either too high or too low, that can predispose you to AFib. Excessive alcohol use, because alcohol can be toxic to the tissues of the heart. The tissue is what generates electricity. So when you have toxicity or scarring, then the electrical activity is also out of whack. If you've had surgery on your heart before, sometimes that can predispose you. And other medical conditions like having diabetes, hypertension, having a heart attack, or congestive heart failure in the past can predispose you to atrial fibrillation.
So you mean that we really do have to keep to the 4 ounces of wine?
Oh, absolutely. Absolutely. Anything in
Dang.
excess will cause damage to organ systems.
Well, so I've had my heart flutter. There's romantic heart flutters, which are really cool. And then you're like, oh, this is
in
so
your
cool.
mind.
And no, it happens. You get that little, and you know what I hate is like, you get the big red face, like, you're like suddenly.
That's in your mind.
No, it happens. And then you're like, oh, dude, everybody knows that I think this guy's hot, It all happens. And you can feel it. And then your heart starts to come up and you're like, oh, stop it. It's not. And once it's like a horse getting out of the gate and starts to gallop. And once it goes, it's off and running.
Oh my God.
Is that okay for us? Like, honestly, I'm like,
yes. So when you have events or any emotional situation or excitement or whatever, your adrenaline hormones increase, and that causes your heart to beat a little bit faster than normal. And that's okay if it's short term and it goes away, that's okay. But if you have long term, I'm talking many days of your heart beating fast for no reason, that can be detrimental to your heart.
okay. I know
That's why people get divorced.
I know,
First
right?
it's all flutter, and then eventually the heart goes, I can't keep up, and then there you go.
It is. I was talking with a friend who just lost a really close person, and we were talking about like how it is to lose somebody in that grievance, and they were like I said, breathe. You need to remember to breathe because it's heavy. And we were talking about like literally your heart is so heavy at a time of passing of someone close to you. It really is. And I was like, yeah. And it's like, it's real. Like it's almost like your heart reminds you that you're alive, you're here.
Mm-hmm.
It's actually really interesting about the heart, like that emotionally your heart takes on that emotion as well. Like
Absolutely.
it's really interesting that you feel that. And we were talking about that. I was like, breathe, because it will make you feel better. Drink water and breathe. It's like being in the altitude of Colorado where we are today, where we're doing this interview. It's the same thing. It's like this pressure. So when it comes to AFib, I'm going to say this from now on because I'm done with the big words. But when I look at the symptoms of AFib, this different rhythm, you going against the grain, it sounds almost like you are up in high altitudes or you're taking drugs. This irregular heartbeat, heart palpitations, lightheadedness, this kind of like shortness of breath. It sounds like you took a good smoke off of a doobie. You know what I mean?
Yeah. It can feel that way sometimes. So patients can have a whole lot of symptoms. Some of the symptoms that you mentioned, like palpitations or fatigue or dizziness, chest pain. And then some patients actually have no symptoms whatsoever. So those patients, it makes it a little bit, difficult to make the diagnosis.
What about for women? Because I know you've written the book, Women and Heart Disease, a real story. And in that, you really remind us that heart disease is the number one killer of women in America, right? And it's killing more women than breast and lung cancer combined. So when it comes to AFib, is it different for women? Is this something women? Is it because you talk about even the symptoms of a heart attack? A woman going through a heart attack are different than men. So is it different with AFib too for women?
So in terms of AFib and symptoms, women and men generally have the same kind of symptoms associated with atrial fibrillation. The symptoms you mentioned before, or no symptoms whatsoever. But we know that the incidence or prevalence of AFib increases with age, and we know that women tend to outlive men, so the incidence of AFib tends to be higher in older women compared to
Oh,
men.
wow.
But I think there's also this kind of mental state that people are in where as you get older, you start to like, yeah, you read all this stuff and then you're like, okay, that's not me. You either become, there's nothing wrong with me ever, or you become a hypochondriac. It's like how to discern, okay, I really should get checked out, as opposed to it's in my imagination, I read too much or I studied too much, especially with the internet where you can access all these websites who tell you, oh, here's your symptoms, blah, blah, blah. And then you're like, oh, no, I think I got that, or no, I don't have that. And you
Right.
self-diagnose.
Yeah, so that's why it's very important for you to see your doctor, especially if you have any of these symptoms that we've mentioned earlier. You really need to see a doctor because several tests need to be performed in order for the diagnosis to be made.
Mm.
And one thing that's really important to know about atrial fibrillation is that it increases your risk for stroke. And that's why it's very important to make the diagnosis of atrial fibrillation, because if it's caught early and you are put on medications to prevent a stroke, then you may not get a stroke, and you'll live a long life and a long and fulfilling life.
Hmm.
Mm.
That's important, and this is
Yeah.
interesting too, because I know we've talked about high blood pressure, heart disease, all of this over the years with you, Dr. Jackie. And I remember doing the Success Insider story with you about, being a, cardiologist and talking about your career and getting in there. And one of the hardest things you said was to get your patients to take their medication. And how hard is that when someone goes through something like they realize, okay, they go to a doctor, this is AFib, and now here comes medication or something. How hard is that? Because you look at, I look at it daily. Nancy and I see it in the news. Oh, this, heart,
Mm.
a high blood pressure pill is being taken off the market because of
Yeah.
all kinds of reasons. And there's all these things, and people are scared about this. They want to go, oh, we're just going to be natural, or we can handle this. And you talk about like we can handle our blood pressure and heart disease and things ourselves. If we have ways to take care of ourselves, but there's a line of where medicine needs to step in. So how hard is that, and where is that line of should and shouldn't? You know what I mean?
Yes. Yeah. So, the patients where you really have no problem getting them to take their medications are those who have a lot of symptoms. Because these symptoms can be pretty debilitating. People end up going to the emergency room, missing days at work, and just having, a poor quality of life with if they're having symptoms from their atrial fibrillation. Now, those patients tend to take their medications. The patients that we have a difficult time getting them to take their meds are usually patients who have no symptoms. When they have no symptoms, they don't feel like they need to take medications. But just because you're not having symptoms does not mean that your risk for stroke is not there. So you need to take your medications in order to prevent a stroke.
Okay.
So for those patients, you have to just keep on telling them about the risk for stroke and explaining that the stroke that you experience with AFib can be pretty devastating because it's a blood clot that just basically showers into the brain, and patients who end up, if you don't die from the stroke, you end up actually being pretty debilitated, either paralyzed or needing a breathing tube or a feeding tube or something like that. And nobody wants that. Nobody
No.
wants that. So it's very important to take your medicine.
That's the worst thing to me. I
So
think about we can age, right? But I don't want to be like,
sucks.
I want to, I want to be able to wipe myself. I'm just saying.
But
And I want to be able to talk, and
And I would like you to do that too.
yeah, I want to be able to be cognizant and age and be
so
there. It's so hard. Like it seems like so much is, we have to be diligent as human beings of our own health. We have to step up as we age.
Absolutely.
Man,
Absolutely.
it's like, wow.
can we say that going into AFib or like having a stroke or all of these things we're talking about, that you are like, you're just walking along and you know that your heartbeat's normal and you're really not even thinking about it because it's normal. And then somehow that heartbeat's interrupted. And it's like you're on 4/4 time and you're singing a song and then it goes to a waltz. So it's 1 2 3 1 2 3, and so you missed a beat, and so your heart actually sort of stops right there. And when your heart stops, everything else kind of stops. Is that a fair way of saying it? Like, and then in that section of where things stop, your system does other things that it wouldn't normally do.
So sort of. So when the heart's fibrillating, when the electrical activity is just chaotic and all over the place, the heart's not pumping well. It's not contracting and not pumping well. So it's kind of stagnant. And when the heart at the top chamber of the heart is stagnant, so is the blood. And you know what happens to blood when it's just sitting there? It forms clots.
Right.
And then it's these clots that move out of the body, you know, when the heart finally pumps. You know, the first place that it pumps to is the brain. So it pumps that clot to the brain. And that's what causes the stroke. So yeah, it's the heart not really squeezing very well. It's just what we say fibrillating, and just like a bag of worms is basically what I can liken it to, just all over the place and not a synchronized kind of contraction.
Yeah, it's out of control.
So it's out of control. So yeah, it's like I'm going off. I'm gonna go rogue, and it's almost like it's like a waterfall. Like you used to have a waterfall in a river, and now it's like I'm a drought, and I'm gonna go crazy where I'm gonna go. So
exactly.
But then now I want to ask, what makes it so, like, we have a list here of things like drinking alcohol, diabetes, obesity. So what is it? Like, okay, you're overweight, so what makes it now that you're at risk for AFib? What's happening in your body?
So with obesity, it predisposes you to all the other risk factors like hypertension, diabetes. Diabetes causes, you know, people to have a heart attack. So the small vessels that supply blood and oxygen to your heart gets destroyed by diabetes. So you're lacking oxygen in certain parts of the tissues of the heart, and the tissue dies. And when it dies, it's unable to conduct electricity properly. So you have this chaotic electricity. So it's all these things together, basically, they destroy the heart piece by piece. And so the heart cannot function normally. And that's what the risk factors do.
It's interesting because it says, like, you know, I've been reading up on this, and it says European ancestry, like if you're European ancestry,
what's up with that?
That could happen. And I remember like African American ancestry would be bad in regards to high blood pressure and diabetes and things like that, because also the foods and the salt and things like that. So this is interesting about Europeans, because then I think about the Lords, you know, getting gout from all their big rich food, you know. So I'm like, as soon as you start reading all these things off about what could happen, I'm like, yeah, you all got gout. You're all like, you know, you're living the high life, and, you know, something's going to come knocking at some point. I don't know.
Yeah, exactly.
But it is interesting that it's like how it goes into different DNAs. I mean,
yeah, it can actually be genetic. Atrial fibrillation can be genetic, and it can be passed on.
So if your family was a king with gout,
watch out.
So can you get tested to know like about this beforehand? That's the one thing I want to know, is like, if you know you've lived a really, you know, gouty life, can you come see you, Dr. Jackie, and say, am I going to get AFib, or like, you know, can we know beforehand? Or
Well, the way we catch people early in the process is if they're having symptoms. So some of these symptoms is what cause patients to present either to the emergency room or, go see their doctor. The problem is always in the patients who don't have any symptoms at all, and they really don't feel like they have a reason to go in to see a doctor. So they can have AFib going on for a long period of time. And a lot of times, the way that they're diagnosed is when they present to the hospital with a stroke. But I say that if you keep up with your regular doctor's appointments, especially if you have risk factors for heart disease, inevitably it will be picked up if you are having these asymptomatic, if you're having them and they're asymptomatic.
Okay.
Can you yourself feel the difference?
Yeah.
Like I know, like when you're scared, your heart rate increases, and you know you're scared. Or if
Oh,
you're
you see a hot fireman.
yeah, like if you're running uphill, you can feel like, at least I can, that your heart is beating faster. So can you yourself feel that your heart is off rhythm?
Yeah, people who have symptoms, yes, they'll tell you, yeah, my heart is it's just off rhythm. That's exactly what they say. It's irregular. I can feel skipping beats and it's just all over the place. Yeah.
Oh, wow.
But not everyone feels it. Then that's the issue. Some people will have this going on and they say they feel fine. But yeah.
Oh, wow. So it's really about this hidden, and is it worse again, like for women? I always want to go back to that because not feeling it or knowing. Yeah, because women, I think women are so busy so many times, and
we're actually
we're multitasking. We're doing so much that I think that sometimes like your heartbeat could go bing bing. This is not normal.
It's in our DNA not to complain. As women, we have been taught for hundreds of thousands of years to not complain.
Yeah, I almost feel like it's part of our DNA to like
not complain.
Give the kid a sandwich before you listen to your heartbeat, and that's wrong. You know what I mean?
Right, it is. Yes, it is. You must put your health first.
Yeah.
You must put your health first.
If you can't put your health first, you can't help your kids, right? And
absolutely.
That's the thing. I wanted to ask this because you talk about stroke with AFib, right? And you've brought up stroke a lot. Normally, we're talking about heart attack. So I need to understand, like, the stroke, heart attack, which comes first? Is it depending on what's afflicting you? I go back to knowing people who've had strokes, and then I'm like, they've had a stroke, then they had a heart attack, and then I'm like, wait a minute, did they have a heart attack first? Like, there's like the heart attack, the stroke thing is so scary. They're both really scary because you can lose really your life, not just dying, but there's dying, which I don't want to be, like I said, I don't want to have someone wipe me, and I don't want to have to not be able to talk, and it happens. I want to be able to be functioning as you age, and you can go through things, but I think this is what's really a scary, scary thing as we age. Like, dude, I could be an old crabby woman, and that's great. Okay, that's fine. But an old crabby woman who doesn't know what's going on or can't be crabby and can't be crabby with my mouth, that's really not funny. And so the stroke, it's really, really, I feel, I just know so many people, close and not close, who aren't able to be vocal, not able to move a side of their body. It's really not, it's not funny. It's
no, it's not
a really terrible position to be in. And, I don't know what happens if, some heart attacks you die, some you don't, and then they do things to you. But like, all I know is when you can't function, it sucks. Like I don't know if I would want to be there at all.
Yeah. It's not a good quality of life, to be in bed and be paralyzed on one side and having people around the clock take care of you because you can't move. It's not a good quality of life. So that's why this arrhythmia is really important. because
So,
of the devastation of a stroke that can happen as a result of it.
so it's a stroke before the heart attack.
Yeah, so this would cause a stroke because the blood clots go straight to the head. So the difference between a stroke and a heart attack is just the organ system that's involved in the ailment. When it's a stroke, it's blockages in the brain. When it's a heart attack, it's blockages in the heart. So,
Oh.
so with the blockages in the brain is when you get the paralysis, because your brain is responsible for, arm movement, sensation, and all those kinds of things. And when you destroy part of the brain that allows you to move your arm and feel things, then you lose function there, and it just doesn't move. Whereas with a heart attack, you have blood clots or blockages in the arteries supplying the heart. So you have tissues that die within the heart, so the heart cannot function normally. So its function is to pump blood and oxygen to the rest of the organ systems to keep them alive. So the heart just basically cannot function, and therefore your organ system will, one at a time, will follow along.
So what about the, I remember reading something that said that within 3 months, organs, whatever part of your organ might go away or degenerate, that new cells would procreate and replace. Is that not true?
Not necessarily.
Okay.
So that's why we end up with end organ damage. But there's a lot of research going into gene therapy, trying to regrow organs, to see if if you have kidney failure or heart failure, maybe we can figure out a way to regrow that organ. But
Wow.
you don't do that normally.
Yeah, don't rely on that. In other words,
No, I just, it's something I read, I've read it a few times where it, but then who says you have 3 months for this, cells to
yeah, that's
regrow?
interesting. That's
Yeah.
well. I remember when I was in high school, they said if every sip of alcohol that you take, your brain cells are dead and you can never recoup them.
Absolutely.
Then it came back that now your brain is in all your cells, right? So you can replenish it, but you can't. They're not going to replenish if you're doing stupid stuff. You can't be. Your cells are going to die if you keep drinking. Let's put it that way, right?
Exactly. Yes,
Right.
exactly.
Yeah. And so in a way, it's even worse because that means all your cells are in trouble, not just your brain cells, all your cells.
Exactly. All the organ system cells.
Right.
Absolutely.
That's what I want to say. It's like really interesting. Just so fascinating. I want to go in the lab and like look at things. Like I want to see it. Like I want to understand like by visual. It's really fascinating, Dr. Jackie. Thank you so much, as always, for joining us on the show and also, educating people with your books. And I know you've got another one coming up, Mediterranean Diet. I'm going to come knocking at your door because I know you're doing this research on the Mediterranean diet. And we just did a segment on that on a show the other day about Mediterranean diet. A friend of ours, the Portofino people who say you can take wine around in a bag. we were talking about we don't always take wine, and we do go around with their bag and backpack and take. And we talked about you on the show, talking about 4 hours only. We were very good, and talked about the fact that we're not always using it for wine; that we use it for taking water in an insulated backpack on a hike. It's better than plastic bottles. So we were very good. You would approve the interview. I know you would. But it was interesting. We were talking about they were just in Greece and they did the Greek islands and everything. We were like, well, what's it like eating there? And they were like, we oversalt, we overdo everything in our food. Like really, like a Greek salad there, like the tomato, it's like a real tomato. It has flavor. You don't need to do anything other than olive oil is what they do. And so it's interesting because I know you're doing it, and the Mediterranean diet, you're doing a book on that. So I can't wait. I'm just saying the holiday season, I want to talk to you about like what can we eat that is good for us during the holiday season. I'm just putting that in your ear now as we talk.
Okay, we'll talk about it then. I'm not going to release any little tidbits until
everybody stay tuned because we've talked to you about the holiday foods and everything over the years, but now I'm like we can eat grapes instead of chocolate, right?
That's right.
Exactly. Like, okay, so the last
Okay,
road
and
trip
I'm guessing olives are out, which was really sucks.
okay, so I'm about to do a big road trip, and the one road trip I ended up drinking Mountain Dew, and I don't drink soda. I drank Mountain and I ate gummy bears for sugar, and I
No,
was all wired and weird. Okay, no, it's true. And then I said to Nancy, I'm like, I can't do that again because I was like, my teeth
yeah.
basically felt like they were melting. Like I'm
She
not
was
used to
doing
that.
that, and I was eating celery sticks.
Oh, bull. but I want to ask. So, driving across country, I'm going to do another big road trip. Is it okay to eat dried fruit instead of gummy bears? For sugar.
Well, dried
Uh-oh.
fruit is probably better for you than gummy bears, but eating fresh fruit is always best.
See, I knew it. Yay, good.
Yeah,
I'm going to stand on the side of the road and eat my mango and let it just go down my face.
That's right.
Juicy
I
mango.
love mangoes.
Aren't they the best?
They are good.
Mango season, and it has to be the right season. And when they come in, I'm like, it's like avocados and mangoes, two things that I can't live without.
Yes, yes, yes.
That's my food group, man. Yes, you can live on those two things, I believe.
Just the name of gummy bears tells you not to do
You're
it.
eating horse stuff with
It
chemical
is.
fillers.
Seriously.
Do you doctors ever eat bad things ever? And like,
Of course.
They have vending machines in hospitals.
Of course we do, but
okay.
I think I can only speak for myself. I really try to eat healthy just so that I practice what I preach and I could be, a role model for my patients. But,
everybody has their day.
It's not easy. It's not easy for anybody.
Okay. All right. So no gummy bears. I will go get the fresh fruit. I'm shopping tomorrow for our big
Gummy bears are disgusting.
Yeah, I know. No, it's horse hoof.
Seriously.
So I won't do that to the horses. So thank you, Dr. Jackie. Everybody, again, Dr. Jackie's book is Women and Heart Disease, The Real Story. You can get it on Amazon. It's a bestseller. She's got another book coming out. I just like to prod her every time she comes on. I'm like, come on. We're ready. We're excited. Go to womenandheartdiseasebook.com. Also, Dr. Jackie practices in Southern California in Orange County. You can go to cvwellnessinstitute.com. Stands for cardiovascular health, right? cvwellnessinstitute.com. Irvine and Orange, California is where she practices. So keep up with her there. And she's also on Facebook and Twitter and all those great places. But as always, thank you so much for joining us, Dr. Jackie. We're going to play this song, Heartbeat, which I know we've played before on a segment with you, but you've been on shows with Nikki Chris, the singer out of North Carolina. And today we really want to play it because she just won a silver medal in the Global Music Awards for the best alternative album. The entire album, Heartbeat, won that. And so I think we got to play that and give her a shout out because it's not the first time this album has won an award as well. So shout out to Nikki Chris. Everyone, you can go to nikkichris.com. It's KRIS, nikkichris.com. But here it is, Heartbeat. Thanks so much, Dr. Jackie.
Thank you. Have a wonderful day.
You too.
There's a firestorm in your eyes, nowhere to hide. I'm out of sight. You've been looking for a fight. I'm on a dead end street. You're like a blinded light. When I'm caught up in your riptide, feels like I'm being buried alive. Oh, I'm a hostage to your greed. There's defeat in every heartbeat. Each new day feels like night. I choke fire.